Coronavirus. Coronavirus.
A new coronavirus, designated 2019, was first identified in Wuhan, the capital of China's Hubei province, after people developed pneumonia without a clear cause and for which existing vaccines or treatments were not effective. The virus has shown evidence of human-to-human transmission, and its transmission rate of infection, appeared to escalate in mid-January 2020, with several countries across Europe, North America and the Asia-Pacific reporting cases. The incubation period time from exposure to the development of symptoms of the virus is between 2 and 10 days, and it remains to be determined if it is contagious during this time. Symptoms include fever, coughing and breathing difficulties, and it can be fatal. As of the 30th of January 2020, approximately 7,823 cases have been confirmed, including in every province of China. The first confirmed death from the coronavirus infection occurred on the 9th of January, and since then 170 deaths have been confirmed. Epidemiological studies estimate that a larger number of people may have been infected, but not detected. The first local transmission of the virus outside China occurred in Vietnam from a father to his son, whereas the first local transmission not involving family occurred in Bavaria, Germany on the 22nd of January, when a Bavarian man contracted the disease from a Chinese business visitor at a meeting in Germany.
In response, cities with a combined population over 57 million people, including Wuhan and 15 cities in the surrounding Hubei province, were placed on full or partial lockdown, involving the termination of all urban public transport and outward transport by train, air and long-distance buses. Many New Year events and tourist attractions have been closed over fear of transmission, including the Forbidden City in Beijing, traditional temple fairs, and other celebratory gatherings. Hong Kong also raised its infectious disease response level to the highest level and declared an emergency, closed its schools until mid-February, and cancelled its New Year celebrations. A number of countries have put out travel advisories warning against travel to Wuhan and Hubei province. Travelers who have visited mainland China have been asked to monitor their health for at least 2 weeks and contact their healthcare provider to report any symptoms of the virus. Anyone who suspects that they are carrying the virus is advised to wear a protective mask and seek medical advice by calling a doctor rather than directly visiting a clinic in person. Some hotels have been providing refunds and no-fee cancellations for reservations in China or by people from China. Airports and train stations have implemented temperature checks, health declarations and information signage in an attempt to identify carriers of the virus. Chinese scientists were able to isolate a strain of the new coronavirus quickly, with the genetic sequence being made available for laboratories across the world to independently develop PCR tests that can confirm infection in a person. Of the first 41 people confirmed by real-time PCR and next-generation sequencing to have been infected, 2/3 were found to have a link with the Wannan seafood wholesale market, which also sold live animals. The seventh member of the coronavirus family to infect humans, 2019 nCoV's genome sequence has been reported to be 75 to 80% identical to SARS-CoV and more than 85% similar to several bat coronaviruses. Whether this virus is of the same severity or lethality as SARS is unclear.